Share. Miriye na maye. Eni menye anye enenam. Kokosechi say. Ochina mesi me dan. Ochina mesi me dan. Ene no ne. Sorry wakai. Nefa wodachi ehye wonsa. Isan say. Woda ene no na wodachi ena woda so no. Enam ne say enti no. Se wo ani so ade hunu bi a. Tuhu anamfa. Midin ene ekwia amwako.
Good morning. Welcome to Medifem Hospital.
Thank you.
My name is Dr. Perfect Alexandra Kuka. I'm a medical officer in this facility, and we are here to have a presentation or a discussion on breast cancer. So I welcome all of you from Ms. Golden Stool 2023 to Medifem Hospital.
Thank you.
Okay. So we'll begin our discussion now. So I'll be as interactive as possible. So I also have what you know about breast cancer, about the topic, and then if there's anything I would clarify, and then we'll do that. And then if you have questions, you ask. Okay. So please, what do you know about breast cancer? Anything at all? Anything Osika.
Maybe I try me ask for the question. The meaning for breast cancer, honey, say a yekokrama, a top no foam. May I say?
Kukroma. Okay, please. Anyone to add anything at all? Oh, I know your names now, so I can mention names.
Okay, me pacho dia me name for breast cancer when I say to send ya me nuaba na kind me to so kokram yare a eto no form empa bebre no aya na emema no nim say emba nko na omunya breast cancer omusu to minya breast cancer man ye.
Okay, a very important point you raised. Yeah, you dream say emma nko na etiminya, but emma ne mbema etiminya breast cancer. It's just that emma no tanya yafa nipa 100 Nipa 99, if I nipa 100 or more breast cancer, nipa 99 beye ma, na nipa ba kwaye bema, but eno ntrese omuntini enye bi. Okay, so breast cancer is basically your cells that become abnormal, and then they overgrow, and then they can spread to other parts of your body and cause problems there. So they would compete with your body for nutrients, for blood, and it would be destroying your system at the same time. And that is why we dedicate a whole month to it every year, so that we can create awareness. If I say obia so ete yare we, then na yebetimi aya fa ho. Say onya yare na then obetimi aye. So onya aye po a then na betimi atre say yare yi bi na eye me. Ana say then obetimi aye de abone ho ban every say yare we. Nti enu nti na October bosume bia ewo afibie mu all over the world we are so afane na we create awareness about breast cancer. Ye bet so akọ symptoms, signs and symptoms. Nyama otimi hu a eba otimi etimi tire say ade a eye me ebetimi aye breast cancer. Eno na ye ba beka ho asem sisi a it's important say be hu say utimi nya breast cancer enu ti na ebo hu dewo because utimi nya breast cancer abra unim kra say wo hu wo hu for in like years and years, and unim time sometimes time obe hu no na asenya ma bebre wo o system nti na ye ka ho asem so that uhu nyama bi say ya temtema na waba hospital na ya hwe mu ahwe say breast cancer na say yare foforo ewo ho etimi ye o breast anye breast cancer ba etimi se breast cancer but ni na mu no tifia unhu say eye say ana eye say nti hu bibisa na waba hospital pacho obi anim any symptom any bibia obehu a obetimi ama na adwen aba so say eye breast cancer na eye no my yidi
pacha me da say na se hu say ensuo enye normal efimu ba hu say symptoms.
so as we walk way breastfeed akola ma akola no fu ense se bibia free we no fu mu ba nsuo bia nti wo ho na wo hu unusual nsuo bia free we no fu mu ba enye normal ebetimi ay say ye yare fufuro bi but wote hwa hu untimi nkyere say eye say ana say but ebeye say ntema utimi ba hospital because ebetimi aye breast cancer and ade aye esuen enye just for yen kwa ye kofia yen mamenum yen aunties say ye bo mo kokko fa yare we hu ne nyama say omo de omo ani eto we hu na omo aye hu bibi
me pacho me wa se musa kakra pacho ma se musa ne say enso na ebe free onufuma ba no red ana se black ana se de kana be
so enso ne ka say enso e free we onufumu ba usually ye kana say ye can in relation to breast cancer ka say enso I said their moja efra but ebetimi aba say enso free we onufumu ba enye moja frown but breast cancer na dey ba bottom line is say o ma akola no for ya ense say bibia free we onufumu ba nti who anything bia just to be sure say red or green or yellow just to be sure say enye breast cancer na start ye we ana say wo ho a say nyama wo ho na waba hospital na yahwe pacho what you say okay nana
Rebacho like say bia onofo no ba ko ye kese chen ba ko ana say onofo ano no e change color and nso so ka symptoms that's
no the America fa ho ne say obia like say ojina hwehwe mu ehwe we nufo a oba bia onufo no utim say ba ko eso chen ba ko kakra ye bedu self breast examination na yaka afa ehu but enunti na say de bia utumi like every boso me bia utumi examine your breast but who say ba ko aye kese a chen other one kwa say utumi hu say we the difference abem ebetimi aye say ababia abem a eye kese na eye sa ebetimi aye breast cancer na eye sa nti hu bibisa na ese odeba hospital na ye hwe ebetimi aye say symptom of breast cancer na developing so obia no for ababi dem deda but who notice say another like abafo for abem usually no na ye commonest sign and kofu hu odeba nti who notice say bibisa abeka ho a ebetimi aye breast cancer na start abem okay other things obetimi hu ni say wenu for o nipple no ebetimi aye ti say there twakom ase usually wonu no nipple no pointed out ebi mo wo naturally omo nipple ne pointy inside but if wonu nipple ne ntesa and then all of a sudden who say ase there o nipple no twakom ana say wonu baby I said there bi tokro bi abeda ho ase dimple who bi owo dimple na fro bi wo dimple wa so who dimple bi sa wo wonu ho a enye normal na ye be kasa for risk factors eno ye nyama as ye dey wo nyama we bia timi increase wo chances of getting breast cancer eno interest say bibi sa wo ho a chinchan che obenya breast cancer but ema ye dey need to ho say it increases your chances of getting breast cancer and also risk factors na bi wo ho a utimi ye bibi fa ho na no we hu say o fall in that category a na why bibia afa ho so risk factors e bi so wo ho untimi ye bibia amfa ho one of it is say oye oba o chances of getting breast cancer high compared say oye bema asa me sure say me ka say ye fa ma ye fa nipa 100 or more breast cancer dodo be 99 be ma ɛna baako bɛyɛ bɛrima nti yɛwɔ 99% of the time breast cancer ɛyɛ mmaa side hɔ. The other risk factor ɛyɛ age. Usually wobɛhu breast cancer ɛwɔ mmaa ɔmo nyin kɔ anim no, the more you grow, the higher your risk of getting breast cancer. But now say yehu sɛ nkurɔfoɔ ɔmo yɛ young 30s 20s ɛso so enya breast cancer. Nti na kyerɛ sɛ age no koraa no ba na ɛba from other factors ɛne sɛ family history. So wo maame enya breast cancer da anaasɛ wo nana na wo auntie wo ebusua obi a wo ne bo ebusua wo enya breast cancer da ebetimi ayɛ sɛ genetics. So ade a ɛka ho a yɛde wo nti ɛno no usually ehu sɛ nkɔfo a obi wɔ ne busua wo enya breast cancer da ɔmo wɔ higher chance of getting breast cancer. Nti obi saa no onim bibi saa na n'ani da hɔ na ɔkɔ hospital regularly na ɔmo hwɛ ɛba sɛ breast cancer na start a ɔmehu ne ntem yehu ne ntem a etimi yɛ bibi ɛfa ho ntem. First na nkɔfo dwen sɛ wonya breast cancer a kyerɛ sɛ wo one no, but ɛno no ɛnyɛ no kɔ sisi a yehu sɛ yehu ne ntem a etimi yɛ nyama bebree fa ho a ɛnsɛ nyama wɔ system mu a otimi yɛ breast cancer free kra ɛbɔ wo bra te sɛ obia. Other risk factors are ɛno no otimi yɛ bibi fa ho bibi te sɛ smoking. Smoking onom cigarette ana jot ana bibi a etimi smoke bia affect your cells and ma o ye prone to cancer bebree. Aside breast cancer, other cancers ni na o smoke a you are at a risk of getting them. And alcohol so alcohol otanum alcohol and also put you at risk to getting breast cancer. Other risk factors also obesity and then hormone therapy obi wo ho a ebia especially omo pa menopause a omo ye hormone therapy ana ebia yare bia o family o fa o use hormones and no to me put you at risk of breast cancer. Nti and there are some of the risk factors associated with it. Okay, so we've already talked about the symptoms and we've said that when you see any of the symptoms that we've mentioned or anything unusual that you are not sure of, you see your doctor. Okay, so we'll talk about the treatment. Before we talk about the treatment, we'll talk about a few investigations, some of the things that if we are suspecting breast cancer, we can do in the hospital. Okay, so some are invasive, that means we'd get into your body, and some are non-invasive. So the non-invasive ones, for example, we can do a breast scan, an ultrasound of the breast, and we usually do that for young women, and then the mammogram for people who are older, above 40, or have had children, and, all of that. Yes, those ones are very sensitive. They can tell if there's something even small in the breast that you may not pick up with your screening or your self breast examination. Yes, and then when it's really on the high side of suspicion, you need to find out what kind of cancer it is. There are different types of breast cancer, like specifics. So they may do a biopsy. They'll take a part of the lump to the lab and test it and see all those fine details. Yes, and then now then there are other tests, blood tests. They'll do some hormone tests and all of that. Now you've done all of that, and then we've confirmed that someone has breast cancer. What are some of the things we can do for the person? At first, people think that once you have breast cancer, they'll cut off your breast. So I've seen people who will come to the hospital with breast cancer, and the breast is so bad, it has become so big and sore and even smelling, and then they said no, they don't want their breast to be cut. Now again, that is just one aspect of management, and as I said, it depends on when you come. So we can actually do breast conserving surgeries. If you come in very early and the cancer is very small, it has not spread, and you've done other tests and you think that, oh, this is one that if we take the lump away, and you do some chemotherapy, you'll be fine. They can actually cut out the lump and then reconstruct your breast so that your breast is still there intact, and then you go on with your life and with your other treatment. Then depending on how it has, the stage in which you are coming to, they may have to cut out the breast. They can cut one breast, or if it's in both, they may cut both. But again, if you see someone who has had a mastectomy or a breast cut off, you might not even notice, because they have these things that they put in their bra and then they just go on fine. Then there are other things they can do. They can do radiotherapy, they can do immunotherapy. Those are different things that, and depending on the type of cancer you have, the kind of breast cancer, they can do in terms of management. So then again, I'm sure everybody thinks that once you have cancer, it's everybody chemotherapy. It's not everybody who even responds to that, depending on the type of cancer. So there's been a lot of advancement in terms of breast cancer management now. So our survival rates are much better. And that is why we want people to seek treatment early, so that we see where you fit, and then we do something for you. So now, that being said, what can I do to prevent breast cancer? Then breast cancer. As I said, you may not be able to totally prevent breast cancer, but we still have to know these things, so that we watch our lifestyle, so that the things we can prevent to reduce our risk of getting breast cancer, we can do it. So, for example, I mentioned smoking as one of the risk factors. So we advise that people stop smoking, and then cigarette smoking, stop drinking alcohol. We watch our diet, we eat healthy, we eat more fruits, more vegetables, we have a balanced diet, we have enough rest. We watch our weight, we don't get overly obese, especially if it's from poor eating habits, eating junk food, eating unhealthy meals. Then we exercise. Exercise is very important in keeping us healthy. Yes, we exercise. And if we notice anything at all unusual from the symptoms we've mentioned, we report to the hospital as early as possible, so that if anything can be done, it's done about it. Yeah.
Auntie Patron pese me busa say ebimu ye de enya akwenya aba ha ba besia ebimu do manya sa akwenya pese me busa say omo wo nkrase no ebia na obia ofoforo sa no wonya yare ni bi no betimi ama ne ba nanufu ana say ontimi ma nanufu. That's it.
Okay. So that's a difficult one. Yes, but people who are breastfeeding, I think sometimes we even think that people who are breastfeeding can't get breast cancer. Pregnant women can get breast cancer. Breastfeeding mothers can get breast cancer. It doesn't. There are different types of breast cancer. There are some that form within the ducts where the milk is formed, and then there are some that form like at other parts of the breast. So it may not necessarily affect the breast milk being produced. Okay, and then nothing may happen to the child. But when you have a breast cancer with a nipple discharge, a bloody discharge, or something like that, that's not healthy. And then, if you see something like that, you yourself wouldn't want to breastfeed your child. But yes, that's not good. That's not good milk for the child. Yes.
Mbani bi breast na are flat, so they'll go for them to raise it up for them so that to be bouncy. Yeah. So that one too, can it cause breast cancer?
It depends on what what was done. There are different things that they do when they are trying to do cosmetics breast surgeries, and some put some things in the breast, and then it depends on what is being used. If it's something that is carcinogenic, that is something that has the ability to cause cancer, yes, it can cause that. But most of the time, most of these things they do are like really safe things that they do. But yeah.
Auntie me pacho me pese me hu ebi wo ho no ma obebo bra obekọ abonte obeba no be yi na Philippines e wo no fum eno so ka ho ana.
Okay. So I forgot to mention, so most of the time when you have breast cancer, initially you don't have pain, and that is why sometimes it goes unnoticed, because pain is something that always pushes us to find solutions. But most of the lumps with breast cancer are painless. That doesn't mean that you can't have, it usually progresses and then you have the pain. That doesn't mean that you can't have some with pain. Yes, but pain does not always mean like a bad thing. As I said, depending on the time of your menstrual cycle, you could have breast pain and heaviness. Also, your bra may be too tight, or especially once with the wire that's pressing on your breast and all of that, you've worn it the whole day, you may have some discomfort or pain. I mean, if it persists, then you have to investigate further what it could be.
Auntie Pacho, Matsu say on brand you bo na metal we bo under. Matsu say ubosa brana, you are prone to getting breast cancer. Pacho, how true is it?
I mean, I don't think that is true. I mean, if you think about how cancer comes about, I didn't go into all those details because they are very technical, and I mean, it wouldn't really benefit us. Yes, some of these things are like quite a stretch. Then again, it depends on whatever material. That's why I said if the thing is carcinogenic, it has the ability to cause cancer. Yes, that's it. But most of the time, the things we use, as much as possible, if they've gone through proper approvals, all of these things should be safe for human use. Yes, so it shouldn't be the case. Please, the last question, and then we'll do the self-breast examination in 2 minutes, and then we are done. Oh, no question. Great. Okay, so I'll quickly go through the self-breast examination. So we have the leaflets. We can already see it, so I'm just going to be quick with that. Okay, so first of all, we have breast cancer. Breast examinations is not only for October of every year. Every single month, at least once a month, you are supposed to examine your breast. The goal of this is that we want you to be familiar with your breasts, so that if there's anything unusual, you can notice it early, and then you can seek clarification or further investigation or tests on that. Yes, so as you can see, you stand in the mirror so that you can see your breast, because you may not have a good view if you are like looking down like that, but in a mirror you can see your breast, you can look around, you can look beneath it, and if it looks unusual, you can also notice it. So you stand in front of the mirror, you look at your breast, you'd raise your hands too, and then you'd also look at your breast whilst your hands are raised. And when you raise your hand, it would your breast is supposed to move up a bit so that you can also see beneath it. And you are also supposed to lean forward a bit and then let your breast drop. Then again, if there's a mass or something growing in one breast, you can appreciate the size very well. So you lean forward, and then you are supposed to hold your hand on your waist, press it. You tense the muscles that hold the muscles on your chest, and then also have a look. Sometimes when there's a mass or a lump that is attached to the muscles, when you tense the muscles, it brings it out more, and then you can have a look. We also need to understand that our breast tissue goes towards the armpit, so it's not just what you see here. You have to also look towards the armpit side, and then you raise one arm like this. You raise your arm behind so that you use the other hand, to the opposite hand, to examine the breast, and you go in circles. You have all the details there. You go in circles from where you start from. You go all around and then up to, you come back there. Also, don't forget to examine the tail of your breast, and then you squeeze your nipple a bit to see if there's any discharge. You do that for both breasts, and then you can do that standing, and then you can repeat that lying down is even more easier, because you are pressing the breast against your chest wall. Then you go through all of those motions. So you do that every month, at least once a month. so that you are familiar with your breast, and then if there's anything unusual, you can pick it. Thank you.
Miss Golden Stool Jumedie near Wafa Hoka Eye. Omo aso yasene Eye. Abuafo enso Eye.